How to identify the warning signs of a stroke. How to identify the warning signs of a stroke. Did you know that strokes are the second leading cause of death and the third leading cause of disability in the world? The information comes from a report by the World Health Organization. But how can you identify the symptoms of a stroke, which can easily be confused with other diseases? Dangerous disease. In 2015, 6.2 million people died of a stroke, according to World Health Organization. The stroke, which is only surpassed by ischemic heart disease, is second in the organization's survey of the top 10 causes of death worldwide. What is a stroke? According to World Health Organization, a stroke is the sudden death of some brain cells due to lack of oxygen. It happens when blood flow to the brain is lost by blockage or rupture of an artery in the brain. Quick response. When it comes to detecting strokes and getting help, the faster, the better. This is because immediate treatment can make the difference between life and death, or the difference between a complete recovery and a long-term disability. Diagnosis. To identify the symptoms of a stroke, the American Stroke Association advises to make a FAST assessment, looking for signs of face, F, drooping, arm, A, weakness, speech, S, difficulty. If you notice all of these, then it's time, T, to make an emergency call. Most stroke cases can only be identified with this test. Face. The first stage of FAST is to observe if one side of the face has drooped. Ask the person to smile. Is the person's smile uneven or unbalanced? Arms. Does the person feel weakness in their arms? Ask the person to raise both arms. Is one of them lower than the other, or is the person unable to lift one of their arms? Speech. Ask the person to say a simple sentence. Does the person has difficulty speaking? Is the person slurring their speech? Time. According to the American Stroke Association, if someone shows any of these symptoms, even if they disappear, call the emergency services and tell them that it may be a stroke. Help will be sent immediately. Emergency. Time is of utmost importance and help must be urgently requested even if you are not sure whether the symptoms are of a stroke. Describe the symptoms. When calling the emergency services, report the symptoms to the phone operator. Other signs. The organization reveals that other symptoms may appear separately, or in combination with the signs of FAST. Disorientation. Does the person suddenly feel confused, have difficulty speaking or understanding what you're saying? Body numbness. Other symptoms that may appear are sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. How's the vision? Does the person experience unexpected problems in one or both eyes? Dizziness. Trouble walking, dizziness, loss of balance or coordination may be other symptoms of a stroke. Headache. Is the person experiencing a very severe headache without any apparent cause? Types of strokes. There are two variations of stroke, ischemic stroke and hemorrhagic stroke. Ischemic stroke. This is the most common type of stroke, affecting about 80% of patients. This stroke variation is caused by lack of blood supply to the brain. Ischemic stroke subtype. Within this variant of stroke, there is also transient ischemic attack, TIA, which is characterized by a passing clog in one of the blood vessels. Ischemic stroke risk factors. Some behaviors and clinical states may contribute to this type of stroke, including high blood pressure, obesity, high cholesterol, family history of heart disease or diabetes, alcohol abuse, and smoking. Hemorrhagic stroke. This type of stroke is the least common. It occurs when there is a rupture of a blood vessel inside a person's skull. Hemorrhagic stroke causes. The main cause of this type of stroke is hypertension, which weakens brain arteries, making them more susceptible to rupture. Hemorrhagic stroke risk factor. Risk factors include obesity, alcohol abuse, smoking, stress, and having a sedentary lifestyle. Most affected groups. Stroke cases are more common in adults over 65. Most affected groups. Pregnancy and the use of contraceptives may increase the risk of the disease in women. Diagnosis. At the clinical examination, a doctor will ask questions about the patient's symptoms and check if they are continuous. The physician will also want to know about any medication the patient takes, as well as their family history of heart disease and stroke. Medical exam. The doctor will examine some signs like blood pressure and heart rate. The doctor may also examine their eyes. Further exams. From a blood test, it is possible to determine the blood clotting time, as well as the level of sugar present in it and if the chemical components of the blood are out of balance. Further exams. Your doctor may ask you to do an MRI and a CT scan. Further exams. An angiogram of the brain shows the brain and neck arteries and enables to detect any kind of changes. With an ultrasound of the carotid artery, it is possible to check inside the arteries for accumulation of fatty plaques and whether the blood flow is normal or not. Echocardiogram. Through this examination, the doctor will see detailed images of the heart. The exam shows if there are any clots that might have eventually moved to the brain, causing a stroke. Ischemic stroke treatment. Emergency medication increases the chance of survival and may reduce any further complications. Depending on the case, the doctor may inject these directly into the brain or perform a surgical intervention. Hemorrhagic stroke treatment. The emergency procedure consists of the use of medications to lower intracranial pressure, blood pressure, and also to prevent vasospasm and seizures. The doctor may also perform surgery to repair the blood vessels. Complications to follow. A stroke can bring temporary or permanent complications, which will depend on its intensity and how long the brain has been left without receiving oxygen. The good news is that some sequels can be reversed with recovery and rehabilitation programs. Paralysis or loss of movement. Part of the body may become paralyzed after a stroke. The muscles most affected are usually those of the face and arms. Difficulty talking or swallowing. A stroke can also cause damage to the muscles around the mouth and throat. Memory. Many people who have suffered a stroke end up losing some memory or have a hard time thinking. In some cases, patients complain of pain, numbness, or other strange sensations in the areas of the body affected by the disease. Behavioral changes. Some patients become socially withdrawn, often because they become dependent on other people for simple daily tasks, such as drinking a glass of water. Strokes are one of the leading causes of dementia and depression. Deep vein thrombosis, DVT. Victims of a stroke are also more likely to suffer from thrombosis in the future. This is when a blood clot forms in the leg. It usually affects people who have lost their movements. Recovery and rehabilitation. People who survived a stroke need support and long-term treatments, including physiotherapy, occupational therapy, speech therapy, and psychotherapy. Please give me a favor by subscribing to my YouTube channel SDK Online Stroke Awareness.